All right, so let's see here. So I already have a PFM over here on the canine. Actually, I've converted it into a full ceramic mostly. So we can just leave that there. We'll do the central here. And even though there's a class 3 on the other central, a couple of them, we'll just do a PFM prep over here, and that'll illustrate what we need to do. So when we're making the mid-facial depth cut, again, this is the 3700012. When you're doing the facial depth cut, we want to take the taper from the middle third of the adjacent tooth, right there. There's the taper. Not like this. Not like this. If it touches that mark, it's the right taper. And keep checking it until you know that you got it just right. You're going to make the shoulder 1 millimeter above the gingival level. So here to here, make it about 1 millimeter. But there's the taper. Use that taper until you get the exact depth cut that you want. Now let's look down the wall, and we'll use the ball burnisher. So here's the small end, the 1 millimeter end of the ball burnisher. We're going to look down the wall. And so now the shoulder at the bottom is about 1 millimeter, maybe 0.9 or so, but we can leave it like that for right now. And as long as the taper is correct, so here's the taper. So that's matching the adjacent tooth just fine. Now let's look this direction, and we'll make depth cuts. Obviously it doesn't make any difference the angulation this way. It's the taper axial that's important. Over here we're going to put the burr as close as we can to the adjacent tooth to make this depth cut. Notice I have the burr leaning a little bit toward the axis. Lean it axially a little bit so it's going to converge with this side. Again, 1 millimeter above the gingiva. Close to the adjacent tooth. So lean it axially, push it axially, and check at the bottom. Okay, so it's about 0.8 right now, so a little bit more. So again, a little taper, close to the adjacent tooth, a little bit above the gingiva. Same thing over here, close to the adjacent tooth, lean it axially, push it axially. But again, keep that 1 millimeter above the gingiva for a typhoid exercise. And the patient would be at the gingival or subgingival right now. Okay, so right now it's still only about 0.6 or 7. So again, lead it axially, push it axially. So when we're happy with the depth cuts, oops. We're not happy until we see what we want at the bottom. There's a little oil on this mirror, isn't there? Let's see if I can clean that up a little bit. Sometimes if you get handpiece lubricant on the mirror, it's hard to get off without soap and water. Okay, so I still need to get more at the shoulder. It's probably 0.9, getting pretty close, so. All right, so I got my millimeter shoulder at the bottom of each one of those. Now I'm going to connect them together. I'm going to join them together. So normally we're never going to look at a wall when we're prepping it, but I can feel the taper. We've already set the taper there, so I can feel it. And then I'm going to start there and cut in between. And as I come around the corner, I'm going to keep the shoulder 1 millimeter away from the gingiva, right around the corner into the, where you had the depth cut there. So now the axial reduction, we need to get more right here though, don't we? So we can look down the wall and see how uniform we're getting it. Now, if the diamond burr starts to get a little bit brown at some part of it, and it's got a little bit of melted plastic in it, then we can take this diamond cleaning stone, which you can see has been used a lot, cut into it that fast, just 0.1 seconds. Cleans up that melted plastic part. Now the diamond burr will work a little bit better. Okay, so I can look down here. So we're getting a millimeter pretty uniformly around that area. Again, it's still horizontal. Now we're going to come around this way. So again, here's the taper. So use that taper. And again, you're keeping your eye on the end of the burr at the shoulder level. You can check the taper again here, and then keep that taper. All the way around the corner. Keep the shoulder near the gingiva, so that when you angle the shoulder, you won't go subgingival. Now let's look this way and see how we're doing on that taper. Okay, so here's the taper that I made in the first place. We want to make sure we have exactly that same taper. So over here I started leaning out a little bit. You see that? So we're going to correct that. We want this taper all the way down to the shoulder. We'll try to keep that shoulder uniform around into the embrasure. So right now, okay, so we need a little bit more right in here. Now let's check the taper again. I want this taper right down to the shoulder. So I'm going to reduce a little bit more right here. Right down to the shoulder. So we don't change the taper at the bottom of that wall, or at the gingival part of that wall. We keep checking that taper and make sure we're happy with it. Make sure when you get to the line angles, we're leaning axially. Okay, 3 depth cuts joined together. Now we're going to angle the shoulder. Now let's lean the burr out like this. So I can see I'm angling it right to the axial wall, but I'm not cutting into the axial wall. And I can see I'm getting some definite angle. Margin's obviously getting closer to the gingiva. If I have the burr parallel to the outside surface, that'll give me an acceptable angle, in that if there is enamel there, it won't be undermined. We know that. Now we talked about how to tell that we have angled the shoulder. So what we're going to do is take the ball burnisher and slide it down the wall. If it slides off, then we've angled the shoulder. I think I'm going to angle a little bit closer to the axial wall right here. In these areas I've got the shoulder angled, and I can prove it by checking with the ball burnisher. So again, I'm looking along the wall in each position so that I can see the angle and see exactly how far I'm cutting in and not cutting into the axial wall. Okay, so we could look down here. So we could do a little more axial reduction in these line angles. But we're pretty close to what we want. Again, I'm getting convergence between these two areas. I'm getting the angulation gingivally right here and right here. So now when I come through the proximal with the chamfer from the lingual, there's a shoulder that's waiting for the chamfer. Now I'm going to do the incisal reduction. 2 millimeters right off the top. We're not talking about clearance now, we're just talking about reduction. We're going to angle it so it's angled toward the palate, which is the way the opposing teeth would grind on it. We can compare it to the adjacent tooth and see that we have 2 millimeters reduction. Okay, then we're going to check the taper on the facial compared to the adjacent tooth at the incisal third. That's the angle that we're going to use for the secondary plane. So if there's something that we can cut at that angle, then we cut it. And that's the secondary plane. Then we can put a little bevel right there. Okay, so do the incisal reduction before you do the proximal reduction so that you don't have to cut as much tooth structure when you're coming through the proximal. Now, I'm going to switch over to the 878K. So there's the burr name right there. And it's got a little melted plastic toward the tip, so I'm going to clean it up a bit. Again, that's all it takes. Now, I can do the lingual reduction like this. I can lean the burr toward the axis. Now, you might be tempted to use direct vision. That's a little tricky on these anterior teeth to look along that wall. Maybe you'd look this way and do a little bit like this. That would be okay. But you can't do much like that. The mirror is what makes it easy to do all of it. So we can look along this wall here. Again, we've got to be looking along the wall when we do the chamfer. So you can see the taper and see the end of the burr at the margin and see the gingival position. Those are the things we have to see. And we can only see them if we're looking along the wall. So this burr, I'd probably have a little trouble getting it through the proximal contact. So I'm not planning to take that all the way through. So I'm looking along that wall. I'm looking along this wall over here. This burr is a little old, so it's starting to burn a little bit. So I'm going to clean it up. Another second. Again, I'm leaning the burr toward the axis. I'm reducing until the end of the burr gets to the margin. And I'm keeping the margin relatively close to the gingiva. Controlling my taper all the way along here. Okay, so that may be as far as we need to go with this burr. So let's switch over to the smaller one, the non-tapered one, the 877-009. And by the way, when you're working with these burrs, keep an eye on the tips. Sometimes you see some diamonds that fall off, and then when they do, it doesn't quite create the chamfer that you have in mind. That's when you change the burr. Okay, so now I'm leaning it axially. End of the burr at the margin near the gingiva. The wall's still a little bit taller than the burr, but we can work with it. Now you notice I'm coming through, I'm looking horizontally along the wall so I can see where I am occlusal gingivally. I'm going to make sure I keep the end of the burr at the margin so it creates a nice uniform 0.5 millimeter chamfer. Keep the taper. Keep the end of the burr at the margin all the time. So now we have a nice uniform chamfer coming all the way through to the facial. And there's that wing we talked about where we go from 0.5 millimeter axial reduction to 1 millimeter. All we have to do to remove that is to lift the burr up a little bit and polish that wing off. And make sure the chamfer joins the shoulder. Now I've already angled the shoulder, so we're good there. So the end of the burr should be at the chamfer margin here, and then you can keep it on the shoulder margin here too. Then you get a nice smooth connection right around that corner. We'll do the same thing over here on the mesial side. So looking along the wall in the mirror. Keep the margin near the gingiva. If you let it rise up here, then you're going to hit the adjacent tooth. Again, looking in the mirror along the wall gives you all the information you need. Get rid of the wing. go from the end of the burr with the chamfer margin to the end of the burr with the shoulder margin, and you make a nice smooth connection right through there. Smooth continuous margins all the way around. To get rid of these sharp corners. Okay, so time to do the lingual fossa reduction. Because you see we don't have much clearance here at all right now. So let's reduce the lingual fossa so we can put some porcelain there. And so we get enough reduction and enough clearance. Okay, so what I'm going to do, this is what I was referring to a little earlier. I said I'd show you rather than try to explain it by a diagram. But I'm going to start by reducing the cingulum with this. This is the 379014 diamond burr. I'm going to start on the cingulum and reduce the cingulum. And then come up here, I'm going to make basically a slot right up here toward the incisal edge and try to save about 1 millimeter width up here after the face reduction is done correctly. So cingulum reduction, concavity all the way up to the incisal edge, then down the marginal ridge to the same level of the cingulum. Try to aim for about 1 millimeter width here, and then same thing on the other side. Down the marginal ridge to the same level of the cingulum. Now, we're going to go back and forth in between. Get rid of the excess between that original groove we cut and make a nice gradual concavity from one marginal ridge to the other. On the canine we do 2 fossae, one here and one here, but this on the central just one. So you can go back and forth from one marginal ridge to the other. I'm going to lengthen the burr just a bit. We're going to refine the shape here a little bit when we use the carbide burr, or the larger football, whether it's carbide or diamond. So the original cut I made is disappearing now. We're blending it in with everything else. Okay, well, let's switch over to the carbide burr and refine and smooth that shape a little bit. That helps us get a concavity that's not too concave. We don't want it to be too concave. So just basically polish it up a little bit. So once we get it, basically most of the scratches out, and it's fairly smooth, we can polish the incisal edge just a little bit. Refine the little bevel right there. And that's basically all we need to do as far as the basic steps of doing the prep. Check the clearance. So we got the millimeter clearance. We can check it with a ball burnisher to make sure. We could do, maybe it's 0.9 right there, maybe 0.9 right here. So we could do a little bit more in those places. Okay, and then, of course, we have to evaluate the prep. So doing the prep is one thing, evaluating it is quite another. So you can go through all the steps, and if you haven't evaluated it, then we don't know what we've done. So the axial reduction at the shoulder, those are the first things we're going to check. 1 millimeter from embrasure to embrasure. We could do a little bit more right in here. We're going to get the angulation of the shoulder, so we check that with the ball burnisher, so we're good there. Check the taper of the facial wall in the middle third, and then the incisal third right here. I could maybe taper a little bit more right in this area here toward that line angle. And the incisal reduction, 2 millimeters off the incisal edge. We can check the clearance at the same time. We just did that. Check your chamfers. Wherever you have a chamfer, make sure the ball burnisher slides off the chamfer, so there's no ski jumps there. Check the height of this wall. I said 1.5 millimeters. I could drop gingerly a little bit more and make that about 1.5 millimeters, but I think the cingulum reduction is adequate. We've reduced the marginal ridge here compared to the adjacent tooth. We've reduced the marginal ridge here compared to the adjacent tooth, so that's okay. And let's check draw. So I'm going to look down the facial wall here and make sure I can see the lingual wall over here. Okay, so if I wanted to, I could taper even a little bit more there, but still pretty good. Let's check mesial distally. I'm going to look down this wall and then make sure I can see this wall at the same time. So I'll look down this wall where we want to see the wall, not the margin, the wall here and the wall there at the same time. So check facial lingually, check mesial distally. Now let's check between the corners. So we're going to check between the mesial buccal and the distal lingual. Okay, that's looking pretty reasonable. We're going to check between the distal buccal and the mesial lingual. Okay, I might want to taper a little bit more in that area. So right at those line angles, I think I'll do a little bit more tapering right here too. So why not? So it's best to make sure if it's not clear that you have draw, then make it more clear. Again, you want the same taper right down to the shoulder. Okay, so, and then we talked about maybe getting a little more taper where the chamfer is. So again, if I'm looking along the wall, I can see the taper axially. I can look along the wall here and see the taper axially. While I'm seeing the end of the burr at the margin, and I can drop the margin gingerly a little bit more right here. Get a little bit taller wall. So again, doing the prep well is one thing, but evaluating it well is another thing. You can do the prep poorly, evaluate the prep well, and then change the prep. Then we're good. Okay, so again, when we check draw, we look down the wall here, look for the wall here. Check from the mesial wall to the distal wall, check from this corner to this corner, check from this corner to this corner over here. So again, seeing both walls at the same time. We're checking 4 sets of opposing walls to evaluate draw. Okay, so some of you have been taught to close one eye when you do this. If you do, that's fine. Some of you have been taught that you can't do it with both eyes open. That's not true. I do it with both eyes open all the time. But when I do it, I make sure that I'm always checking walls that appear horizontal to my eyes. So that's why I keep changing my position so I can check pairs of opposing walls where they always look parallel to my eyes this way. They always look horizontal when I'm checking draw between opposite sets of walls. That's what you have to do if you have both eyes open. And we can prove that on the board a little bit later if you want. Okay, so this basically is all you need to do as far as the PFM on the central. So let's go ahead and do that, pretty much following the guidance I just gave you. And do it according to the stepwise approach and then evaluate it. And then after we do that, we'll move on to the canine. Okay.